Hello and welcome to FIP's Transforming Conversations, the podcast series that brings together pharmacists from around the world to have in-depth conversations and share stories on topics related to leadership and personal growth, the highs and lows in their professional lives, and their unique experiences and lessons learned facing multiple challenges. Please let us know what you think and tell other people about FIP on social media. This is FIP's Transforming Conversations, and I am Dahlia Burgess, your host. Dallas Smith currently holds a position at the Centers for Disease Control and Prevention, CDC, as an Epidemic Intelligence Service, EIS officer in the Mycotic Diseases Branch, MDB. Dallas has been a member of FIP since 2019 and was awarded the Professional Innovation Grant in 2020. Dallas graduated with his PharmD from the University of Findlay, Ohio, the United States in 2017, and ever since has been immersed in public health roles in different countries. I would say that Dallas has been a public health pharmacist on call. Let me give our listeners an idea how you are a public health pharmacist on call, Dallas. After graduation, Dallas was accepted to serve in the Peace Corps as a community health educator in Cambodia for 2 years. His passion for holding and building capacity and empowerment led him to an additional tour with the Peace Corps response program in Malawi as a clinical pharmacy and pharmacognosy lecturer at the College of Medicine in University of Malawi. Due to the COVID-19 pandemic, Dallas was evacuated back to Arlington, Virginia, where he managed a COVID-19 testing site and subsequent vaccine clinics. He also continues to teach virtually at the College of Medicine in Malawi while being involved in a variety of projects with the institution. Now, outside of work, Dallas enjoys cultivating native plants and fruits, listening to musicals, and learning about traditional and complementary systems of medicines. In July of 2021, Dallas started the position at CDC as an EIS, as I described earlier, also known as a disease detective of CDC. Now, this means that when disease outbreaks or other public health threats emerge, EIS officers like Dallas investigate, identify the cause, and rapidly implement control measures and collect evidence to recommend preventative actions. It's all sounding very exciting to me. So I'd like to formally welcome Dallas to the call. Welcome, Dallas.
Thank you so much, Dahlia, and thank you to FIP for hosting this podcast. I'm excited to talk a little more about the intersection of pharmacy and public health today. So thank you again, Dahlia.
You're very welcome. Dallas, why should pharmacists become more ingrained in public and global health?
Dahlia, I think to a certain degree, pharmacists are kind of already critical in public and global health initiatives. For example, we are already uniquely situated in communities, providing health education, vaccinations, and supporting primary prevention. Pharmacists also play a substantial role in essential health services globally and can offer clinical expertise in rural areas where other healthcare professionals may not be serving. However, I think one of our big limitations in public health as the pharmacy profession are that pharmacists are not formally classified as a public health profession within the public health workforce, which limits our impact on population-level health. And just to give you some context about how important pharmacists are, we can go back to the COVID-19 pandemic, where the role of the pharmacist has exemplified what we can do in disease outbreaks and pandemics and public health responses. And the pandemic has actually fueled a desire among many young pharmacists and young pharmacy professionals to work in the realm of public health and global health. Pharmacists have answered the call again and again during this pandemic to serve during this global health emergency in areas ranging from testing and vaccination administration to addressing supply chain concerns, which have hindered basic health services. And just to exemplify what the importance of pharmacy in public health is that pharmacists has a unique knowledge of the medication use system that other professions really don't have. And it's crucial in the development and implementation of public health prevention strategies, interventions, for example, like mass drug administration to control neglected tropical diseases. Um, and some other examples are dispensing medications and administering vaccines, like throughout the COVID-19 pandemic, developing clinical treatment guidelines and thinking about therapeutic drug monitoring and side effect management and drug-drug interactions for both infectious and chronic diseases. And also, one of our mainstays is educating the public on pharmaceuticals and health-related topics as, in most countries, the most accessible healthcare professional.
In your current role, Dallas, it seems you often experience the intersection of pharmacy and public health. Could you tell our audience and our listeners a little bit more about those experiences that you have had in this realm?
Yes, I'd love to. And just I'm very lucky for the position I'm in currently. And I've had a wide range of these experiences that really intersect between pharmacy and public health. I've had really broad population level health experiences that may not be actually pharmacy or specific to pharmacy, while I've also had more specific experiences with a pharmaceutical component. So some of those broad population level health experiences that I've had include responding to an influx of Afghanistan refugees when they got evacuated to the United States. And I actually got to work on a hepatitis A and measles outbreak on a base where these refugees got evacuated to. I've also been able to respond to a new, deadly, emerging, and typically multi-drug resistant fungal disease called Candida auris in several locations in the United States. I also helped throughout the monkeypox response from a domestic standpoint in the United States, liaising with state and local health departments to provide information and connect them with resources in a time where there wasn't a lot known about the current monkeypox outbreak. And one of my favorite deployments have been to Malawi, where I still actually teach at the university there, but this time I was there to respond to an outbreak of the wild polio virus. And I've spent several months there working with local and national staff to try to contain this wild polio virus outbreak, where Malawi hasn't seen this virus in about 30 years. So it was pretty significant that it reappeared in this country. And because I am a pharmacist and very passionate about pharmacy, I've been able to incorporate some of my background and some pharmaceutical components into my public health experiences. One of them was working with the CDC's COVID-19 International Task Force, and I was serving as the subject matter expert with oral antivirals for COVID-19 and working with ministries of health globally and some other external partners to really figure out how to implement and prepare healthcare systems to utilize these life-saving medications, but they also carry a lot of baggage. So how can we address some of those barriers so that they're effective and can save lives? Another one is that another project I'm currently working on is looking at analyzing national therapeutic drug monitoring utilization in fungal diseases. We normally think of, we want to make sure we diagnose the disease. We want to make sure they get the right treatment. But for some medications and some diseases, especially fungal diseases, we need to make sure the right amount of drug is in the body to be effective. And so we want to make sure we're advocating and promoting therapeutic drug monitoring. So we're trying to get a good baseline of what's actually happening on the ground.
That's really interesting, Dallas. And I'm sure that you would agree that no job comes without challenges. In your opinion, what are 3 challenges you've faced as a pharmacist in your public health role?
And Dahlia, I think that's a really good question. And I think a lot of pharmacists in public health are struggling with that. And so I think number one is that pharmacists are a fairly new face to public health in terms of being recognized or having those high level or national public health positions. And it often takes time to find like a niche place within a program or initiative for pharmacists. And some people also don't realize what pharmacists can bring to the table. and how to effectively utilize their unique background in programs and policy development and public health initiatives. Number two, I think gathering support for pharmaceutical related public health projects can be difficult. In terms of funding, may not be available. And so with these gaps in funding, we may not be able to really investigate or really interpret some results that could impact public health from a pharmaceutical perspective. And I think this kind of stems from maybe leadership support may not realize it's important immediately just because it hasn't been really done in the past. And so it's not on the top of people's minds. And also, there's a lot of priorities in public and global health that may take more precedence than maybe public health from a pharmaceutical perspective. And so, which is understandable, but we just got to keep pushing and pushing and pushing because these are big population health interventions that can really save lives.
That's really super important, isn't it? To be able to also tackle these challenges head on. You've already mentioned that you continue to teach virtually at the College of Medicine in Malawi. How important is public health education in pharmacy? And how important is that for pharmacists and to increase also their participation in population health, but also to raise awareness?
I think the way we get pharmacists more ingrained in public health starts with education. And I think we can do this by a variety of ways. I think initially throughout coursework and throughout curriculum development, we can incorporate some of this public health education. Courses like pharmacoepidemiology courses would be really important just because a lot of public health has a lot to do with epidemiology. And if we're able to really combine that pharmacy component and epidemiology component, I think we could really take pharmacy and public health to a new level. And thinking about people who have already graduated or want to enter the public health workforce as after getting experience as a pharmacist, we need to really think about workforce development. And so we can always use continuing professional development to train pharmacists as public health professionals. And there's a lot of good resources out there already, but I think we could always expand that repertoire of courses. And we can also seek out these postgraduate public health training opportunities like CDC's Epidemic Intelligence Service, which I'm currently in. And actually, a lot of countries have a program that was designed based off of the Epidemic Intelligence Service called the Field Epidemiology Training Program, or FETP. And these are epidemiology training programs hosted in countries all over the world that a lot of people can apply to. And they range in duration. They can be 3 months, they can be 6 months, they can be 9 months, they can be a year. And so I really encourage pharmacists who are interested in public health to check out their country's FETP program to see if they're interested and to see if they'd like to be involved, because it's a great opportunity to learn basic epidemiology skills to impact public health. And of course, when you go through that program, you can infuse a pharmaceutical component throughout it too. There's also a global health fellowship program that's hosted by the CDC that I encourage everyone to check out as well. And also for those go-getters, I also recommend taking extra classes on epidemiology and statistics because that's really the backbone of public health and can really inform public health decisions. Another aspect that I think pharmacists should really be involved with is looking at how can we impact public health laws and regulations. So can we work with other healthcare professionals to improve public health in communities through policy development, through regulations? And we want to make sure we highlight the importance of having ministries of health or other regulation bodies include pharmacists' perspective and input in public health laws and regulations.
I think this leads on really nicely to what you think, in your opinion, are the next steps for pharmacists involved in public health.
I think this is a really timely question because we've seen the emergence of this test and treat or test to treat services that have been gaining more traction globally in the US and everywhere in the world. And I think this is really something that pharmacists could get involved with and could really revolutionize our role in public health and our pharmacy profession in general. And so, just to give you a little background on test and treat, test and treat is the concept of facilitating expedited access to treatment as soon as someone tests positive for a disease, often on the same visit. So, someone goes to a pharmacy, they think they may have COVID-19, they get a rapid test, they test positive, they get treatment all within the same visit. So you don't have delayed diagnosis, you don't have delayed treatment. And to think about from a global perspective, pharmacists in many parts of the world are already dispensing medications without a prescription. If they were trained and equipped with the diagnostic tools, test and treat services could save lives, it can improve antimicrobial stewardship, it could improve chronic disease management, and it could prevent inappropriate medication use. And so, thinking about how the COVID-19 pandemic has really influenced these test and treat initiatives, we've seen that the COVID-19 pandemic has placed substantial strain on the global healthcare workforce, disrupting essential and non essential services. If we do task sharing of these test and treat services to non traditional prescribers, like pharmacists, they can facilitate more resilient healthcare systems by expanding access to health services while simultaneously decreasing the pressure on traditional healthcare providers. And so we do have to think through a few barriers that we've encountered in the past for test and treat and just expanding the role of pharmacists in general. And I think we got to think about some socio-political issues, some resourcing issues, and of course, we always want to make sure we have the correct training as well. And once we start implementing these test and treat services, we want to make sure we're monitoring and evaluating these services and looking at the outcomes so that we can facilitate the scalability of test and treat initiatives both in a regional and a global level. And I really think pharmacists are really uniquely positioned to bring testing and treatment from the clinic to the community, and I think it could really help save lives and prevent severe disease in communities.
That's really interesting to learn more about the test and treat services, Dallas, and the impact it could have on improving health for all. Now, I just wanted to touch on FIP's mission to advance pharmacy worldwide. FIP in 2020 shared with the profession at large 21 development goals to advance pharmacy worldwide and to bring us closer to achieving universal health coverage through primary healthcare. Now, for our listeners who want to learn more about the FIP DGs, do visit our website on developmentgoals.fip.org. But one particular development goal is DG 10 on equity and equality. How can pharmacists involved in public health and test and treat services, as you just described, Dallas, meet DG 10?
I think equity and equality really starts with access. And in most countries, pharmacists are usually the most accessible healthcare provider. And so having the ability to test and treat and then provide immediate treatment to rural, hard to reach, or in even vulnerable communities in urban areas like in slums is a equitable intervention that can really improve health outcomes. And if we're able to equitably and if we're able to equitably provide these test and treat services, we could prevent large and expensive commutes to hospitals and precious time missed from work in these populations that really can't afford to miss a week or even a few days of work because that will significantly cut back their income and be able to provide for their families. And it's important to have the highest quality medications to populations suffering from the disease the most. And test and treat services by pharmacists could help facilitate this by being in communities, by having access to these life-saving, high-quality medications, and then being able to get them to people who need it the most as soon as possible.
This is very relevant to the work that FIP leads in the area of non-communicable diseases and the management of chronic diseases. And I think it's wise of us to share with our listeners that they can find a lot of resources on managing non-communicable diseases, which really links nicely to what you're describing there, Dallas, about test and treat services and the importance of exploring this particular concept. But to conclude, because this has been a really enlightening and also inspiring conversation to learn about your role in public health, I'm wondering about your final message to our listeners today, Dallas.
I think my final message is that I want to encourage pharmacists globally, wherever you're at in the world, to get more involved with public health. And this could be at a local level. This could be at the pharmacy you currently serve at, the hospital you currently serve at. This could be improving health education in your community. This could be improving antimicrobial stewardship at your hospital. But I also want to encourage pharmacists to get involved at a more regional, national, or even international level, like with FIP, because we have the ability to influence and impact population level health and global health to really save lives. And pharmacists can provide that unique aspect that can really help facilitate improved interventions, improved projects that may not have been influenced by pharmacy in the past, and which is really exciting to be a part of. And if we're able to do that, we can really elevate pharmacists' voices and recognition in the field of public health to further expand our role in population level health.
Dallas, I think you've inspired our listeners today with your role in public health being on call. And we want to wish you all the best with your future endeavors in pharmacy and with the intersection with public health services as well. Thanks a million for joining us on this podcast recording.
Thank you so much, Dahlia, and thank you, FIP.
Many thanks to our guests. We hope you enjoyed this episode of Transforming Conversations, hosted by FIP, the International Pharmaceutical Federation. Please let us know what you think and tell other people about FIP on social media.